Lovely people, you are welcome to our expert desk session show with Dr. Slim today. And today we are going to talk about nurses. So Dr. Slim is a registered nurse who is now specializing in orthopedic, and he has practiced for some time now, and he has experience when it comes to the nursing. And we are going to talk from forms to frontline. What we are trying to say is that we are going to consider those who want to aspire nursing, those who are currently in school, and those who are already in practice. Some of the questions the world wants to know, some of the questions we want to ask them, and sometimes what they also feel when they are on the field. So Dr. Slim, you're welcome.
Thank you very much, Echo.
Yeah, your host, I'm Echo EKO, and I welcome you once again to Expert Dex, the podcast where professionals share real life knowledge to guide your career decisions. And today, as I said, we are going to talk about nursing, and it's a crucial topic in our society. It's a place where nursing is one of the things that we underrate, but we want to know more about it.
Yeah.
Maybe you want to aspire into nursing. Maybe you are in school right now as a nursing officer or nursing student. You want to know what is going on the field. And you're also in practice, but you are finding some challenges. This podcast is for you. And we hope that after or before or after this show, or after listening to or watching this show, you'll be able to also get your answers. And if you have any answers too, you can put it in the comment section, and we'll have the opportunity to answer you. So Dr. Slim, I think I've already introduced you.
Yeah.
I don't know, but if I should give you some time to introduce yourself proper.
That's just it. You've just done justice to it. So I'm a registered nurse who is now specializing in orthopedics.
All right. So the bigger picture is that, in a simple terms, like why do you think nursing is essential in a hospital?
Okay. This is a broad one, but a good one. I think this is going to clear a lot of doubts, maybe about nurses, maybe when we are down or going down this lane.
I'll be happy.
But then, you see, nurses, as we are much, that's how much we do.
Okay.
So you see a lot of nurses in the hospitals because they have a lot to do when it comes to the health settings. So we basically say nurses are at the center of healthcare. They are at the pivot of everything, whereby they interrelate with all other units or other disciplinaries to make a conclusive health. So nurses will have, doctors will have to follow nurses, lab technicians will have to follow nurses, any other daycare will have to follow nurses to get things through to the patients. So people, a lot of other daycares may not like this, but then nurses are more closer to the patients than any other. Any other
I think I agree. I agree. Thank you so much. So let's start from the genesis. Like I'm a SS graduate, and I want to venture into nursing. Where does the journey start from?
Well, basically people think it should start from the time you complete, and maybe you've got some nice grades that you want to share with the profession. But then I believe nursing starts from childhood. Yes. Just as pastors are called, I believe nurses should be called.
So it's not something you can just wake up and start doing.
Yes, it's not basically just trying to be an expertise about it, but basically you having the inner interest for it.
That's true.
Because it's a work that actually brings out a lot.
Right now, the grades, you talked about the grades.
Yes.
So right now, my grades are okay.
Yes.
How do I go about it? Where do I go? Where should I buy the forms? And then after buying the forms, what procedures do you follow? Oh, yeah, how will I go through? Yeah.
Okay, so basically just like any other tertiary, when the forms are out, they come just like the zip code, whereby you purchase the voucher from any bank or online. Then you fill the form online, submit the hard copy to the either the schools, or you can just complete everything online. Then you'll be called for an interview session. So you pick the particular school of choice that you want to go to, based on the priority. That's from the first to the second, and based on the regions too that you want to pick from. So from the purchase of the form, you'll be called for an interview session where you have to actually prove yourself, the reason why you really want to join the fraternity. That's where they get to meet you, check your documents and whether they are valid for the school, and whether personally you have any problem that they might deter you from actually doing well with the course or the nursing. And from there you are called for admission.
So I want to know. I've been admitted to the school. I've started schooling the classes. We see a lot of nurses. Some are in white, some are in green, and even the green, we have the one that is pure green, no white at the neck. We have some too, there are whites at the neck, and there are some people too in brown. And I want to know, what are the differences?
Well, they are just basically different cadres of nursing, just as expected. So just like the way we have military, we have Navy, then we have the Armed Forces, then the Air Force. So as nurses, so basically those in green, the green comes variedly. So there are registered nurses in green, registered general nurses. Then there are registered community nurses as well.
They are in what?
They are also in green. They also wear the green with the normal white distance. Yes. But then they are registered community. Before we have the health assistants people. Then as well as the basically the community nurses.
The community nurses.
Yes.
So do they perform the same functions at the hospital?
Well, we all have our scope of work. I left out the enrolled nurses. They are with the green without the white Peter Pan color. Yes. So basically, when you see those in green without, but most people are also in there. So they come with the green, but with the white band. So green with the green color. Not white, but then they are marking the white band. The band simplifies something. So yes. So basically, you ask again.
So I'm asking that. Do they perform the same functions?
So just like we all have our job descriptions, basically everywhere. That's how nurses also operate. So we all have our job descriptions. Basically the white, those in white are the green nurses with above ranks, and basically they have also their roles, because most of them happen to be the nurse managers, the matrons, and what have you, the in charges of the units. Depending on the facility you locate yourself, there are some places that even the degree nurses are.
I get it. So I asked of nursing because you were explaining about their fashion, like they are the integral part, they are closer to the patients. And all that, and I think they help to administer some responsibility and some information to the patients and all those in the hospital. I think I get you right. Then now, if I get to a hospital, as soon as I get there, how will I know this one is a degree nurse, this one is a registered nurse, this one, like I want to know. Maybe now I know the health sector or the health a ministry.
Yes.
Brought crops, like you should be in crops. You should wear something that is scraps. Scraps. So now you don't know. So how would I know that this one is degree, and like what is the distinctions? What are the distinctions of the degree nurses, the certificate nurses, and other? You understand what I'm trying to ask? Yes, I want to know, because it's an information. It's something that a lot of people want to know.
Yeah. Okay. Well, basically, right now, actually, with the scrap. Before I touch on even the uniform discrepancies, with the scrap, you don't get to really see the differences, because we are all in scrap. Even the onlys are in scrap. So you only get to see their distinct responsibilities when they are being performed. So you get to a particular stage whereby you require a particular care. Then they call in a particular person to perform it for you. That's when you know that, no, then this person is this person. Nonetheless, I would say now the system is in such a way that we are all able to function anywhere. Yes.
So it means whether you a degree or whether a certificate, whatever, it doesn't really matter when it comes to the job.
It doesn't really matter when it comes to the job, because you can be a degree nurse. But then where we need your services is at the reproductive and child health, the RCH, where we check our babies' weight and what have you. Those are the preventive nurses, and they are doing awesomely well that we don't actually recognize a lot. They go to the grassroots to prevent a lot of conditions that will really deter us if they should come as emergencies, or if we should encounter them as conditions to take care of as curative nurses. So we have the preventives, we have the curative nurses. So the preventives are the ones, the community, basically we call them community. So you remember I made mention of the registered community. Basically most of them are the heads of the preventive units. Yes, and the public health nurses also. So it's either you are the preventive side or you are the curative side. But being a general nurse, you can function anywhere. They can place you anywhere of these places.
So thank you so much. We are getting further. We know nurses. When you talk of nursing, especially in our region, in our side of the world, most of the people choose nursing basically because of maybe after school they can post me. Maybe I don't have any job to do after. Maybe when I go to the university I will not have any job. So let me pass through nursing. And so with this kind of motive, which is obvious in our society, what impact has it brought to nursing ministry, or let me say the nursing fraternity?
Well, I wouldn't say it's not in any other profession. I think it cuts across, but then I believe maybe it's the nurses that are making their own obvious. Apparently I said nursing, to me, I believe nursing is supposed to be a calling, because our mother of nursing being Florence Nightingale, she was from a very rich family. She was a princess. She lacked nothing, but she gave all up to just go and serve and treat the soldiers, the wounded soldiers at war. That's how nursing began. So I believe if you are not willing to sacrifice, you can be the good nurse. So even though the salary could be enticing, it's not that much, but then it's quite better. Yes, it could be an enticing one, and it could be an easy way out, like as in a shortcut. Like let me just use it as a cut to enter into a field without going through a lot of processes. But believe me, there are processes with the nursing fraternity as well that you go through that might really stress you out. Especially the schooling, the clinicals, and what have you. So I believe, in as much as people, it's not everyone that goes into the profession with the interest, the much interest needed.
Okay.
I believe for you to be able to sustain and withstand the pressure, then I think you have some level of interest, or maybe you grew the interest on the job to be able to sustain it, because it's a whole lot of pressure. If you are not called for it, you can't sustain it. You run.
Okay, so as Dr. Slim said, this is expert desk. We are here with him. We want to know more about nursing in our region, and I think nursing is one of the let me say, nursing fraternity is one of the places where whatever happens in Africa happens in Asia, happens in. So I think it's integral. It doesn't have any, because it's about caring for human beings. The same thing. So if you are outside of Ghana, you are outside of Africa, and you are watching this one, whatever information we are giving here, it should be something you should expect whenever you want to choose this particular part. And Dr. Slim, we want to continue with our interrogation and with our conversation. We want to know more about the nursing. You know, right now, I want to know, you see a lot of, casualties. You see a lot of cases.
Yes.
You meet a lot of emotional, damaging, and traumatic, and even threatening situations at the ward.
Yes.
How do you manage that with your psyche? Or let me say your mental health. Like, how do you manage that? I think there are a lot of people in practice who needs to know about this. So I want you to help us.
Well, basically, I'll share an experience. Yes, so when I was admitted during our batch, I think there was a time where we're going on an orientation. So upon we arriving at the emergency unit, all of a sudden there were casualties. Like accident victims being brought in. There were a lot of people with veered arms. Then there were a lot of bleeding cases that were going on. And just there and then they asked us to pick gloves and get to job.
Start working.
Yes. Could you imagine there are a lot of nurses who were going on an orientation who fainted at the sight of blood?
Really?
Yes.
They fainted?
Yes.
Why didn't they prepare for
some people that couldn't even continue just at the sight of that scene. They couldn't continue. Yes, they had to step down. They had to step down. So I still come back to this, that if you don't have the willpower and the interest, you can't. Aside everything, you should have the willpower, and you should have that enthusiasm to save.
To save life.
Yes. So I don't know if you have come across this video that has been circulating, like nurses pulling their trolleys, running, falling here and there just to save lives. It's just something you do, that you just have to put your life on the line. So you can go hungry just to save a client. I can't remember the last time maybe I've taken breakfast really. Maybe it's only when I decide to take breakfast but if I skip breakfast, then am just going to miss it for the rest of the day.
So meaning,
because when I get to work, I forget that I haven't eaten. Because when there is a dying patient, first you have to see yourself in a person's shoe. What if I was the one on that bed? What will I do? What will I expect from the person that might want to save me? That is what I will do. So if you are not empathetic first, if you don't have human sympathy, you can't be a nurse. So even it haunts us when we know that we could have saved this situation, that we couldn't. Sometimes we get home, we blame ourselves, we reflect. Sometimes you have nightmares with those things. Whilst you can't save all. Definitely.
So with sometimes these things that you go through, does it have some negative impact on you in a way? Does it affect your family, your education, your psychology, your even human relation. Does some cases bring these things to you?
Well, it does a lot, because we have been so exposed to humans and how easily we can lose lives. So, well, I would say in blunt terms that we believe human beings are nothing.
Okay.
Like,
so is that why you people don't respect?
well, we believe because we are nothing. Like, you shouldn't see yourself so much important than any other person. Like, we believe we should all be equal.
So why the doctors are very humble?
Really? Well, maybe you have met the humble nurses, doctors, and have met the rude or arrogant nurses.
But it is something that is everybody at all out there knows that nurses don't respect.
No, well, I would say the reason why...
This is the opportunity to clear all those down from...
I would say the reason why the doctors' side are not really exposed is because we saw much of the pressure before they come in.
Oh, okay.
Yes. So you can just imagine like somebody coming with an emergency, shouting on you at the same time. You have to reason, make a conclusive judgment, writing at the same time, calling the doctor to inform. That time even the doctor is home.
That's true.
Yes, I'm not saying they don't. They do a lot. But probably as at that time that emergency came in, the doctor was at home. You have to at least stabilize before you call the doctor. So after then, the interaction with the family and everything might be so stressful, and it might take you off. So by the time the doctor comes in, maybe the atmosphere is
you're doing clearing agents.
Why not?
You're doing clearing agents. You're doing a lot of damage control. Yes, I have people. But I think our next episode we'll be talking more about certain things. But then today we are focusing on from forms to frontline, right? And that is why we are. So personally, what do you have to say to a patient coming to the hospital, coming to meet a nurse? What would you say? Let's say maybe you have an auntie or somebody going to the hospital and they call you Dr. Slim. I'm going to the hospital. What do I do? What are you telling that person?
Well, basically you start with the empathy part. Like, put yourself in a person's shoes first. So
I'm asking me going to the hospital. Who is the nurse? That I'm going to sit. He said, "Come, check your temperature, the vitals, and those things." I know that is what the nurses does. That is what we know them for. And after that, they will refer you to a doctor. That is, I think, that's the process we've been through. Now I'm trying to say that me as a client, when I'm going to the hospital, what should I expect? What are some of the things I should put at the back of my mind so that I will not be disappointed?
Well, the thing is, I believe we expect so much from nurses. Too much. Rather too much. We can't do it all. We are also humans. Sometimes somebody may be coming from home with a lot of baggages.
That is true.
But then you have to put it aside to do the real deal with you and save you first. Then when you get home, then they take care of the rest. So we shouldn't expect too much. We should expect that nurses are also human beings who have gotten an expertise in this field and are willing to help. We shouldn't go with a mindset that we are going to challenge this nurse, or we are going to look down on this nurse, or maybe we are going to make this nurse feel bad because maybe already we have tagged nurses that they are not really good. They are arrogant people. So maybe when I get to the hospital, I'm going to show him pepper or her pepper. No, we are humans. You might meet a very nice and welcoming nurse today. That's true. Then tomorrow you meet somebody that is rude. It doesn't take anything away from the profession. So with the aspect of the rudeness of nurses, will you say that it is a character trait or it is professional? It's a professional syndrome. Do you understand? Yes, I get what you are driving. Well, we didn't say it's a professional trait. Maybe sometimes it's just a defense mechanism to just help people or help the relatives relax.
So is that the reason why sometimes you shout on us like?
No, like basically we are not supposed, in every situation we are supposed to be calm. See, you can slap me. You can slap me, then so far as I'm in my professional uniform, I shouldn't react.
Yes. Nurses shout on patients.
Yes.
Sometimes they administer drugs to the patient, and maybe the patient, instead of take two, I can't take those, and then they begin to shout on them.
Yeah.
Is it part of your ethics? Like?
No, it's not part. It's not part. Basically, it's not part, but it's a human institution, and we are doing a humanitarian work. And to deal with humans is a handful work. So somebody we have our individual differences. How you take an instruction may be different from how Wusu would take an instruction, same instruction. So maybe to just compel you to do the needful. But there are some patients that actually need that shouting to help situations.
Yes. It's I can't say because I'm not working there.
Yes.
So I can't say. But if it means that by your discretion, if you realize that the patient needs that shouting,
yes. When you are really going out of board, and it will harm you yourself. Because we swear an oath to save you. So when you feel you are going to harm yourself too,
Can you throw a little highlight on the nursing? Like, I know you are there to save life, but I don't remember. Is it only to save life?
Or aside saving lives, we do a lot of things, counseling and what have you.
No, I'm asking because if you are there to save life, why should people come and die?
Now I get you better.
You get me better.
Most doctors too have lost cases, but we don't individualize losing cases. We lose cases as a team. So when a case is lost, we didn't say the nurse lost the case, the health team failed. And sometimes it's not from our side as well. Maybe it could be that what we have on board will be overwhelming, that we couldn't handle really better, or sometimes a delay to help.
Doctor, please, you have practiced this for some time now.
Yes.
What are some of the mistakes you think practicing nurses are doing now?
Basically, I feel we are not challenging ourselves enough. And we are restricting ourselves because we feel the doctors too should do some. Do you get it? So basically, nurses should challenge themselves. We can do more than we imagine we can.
That's true.
There are a lot of nurses that are doing a lot of challenging stuffs that even doctors learn from. Yes. A lot of cadets, we learn from each other.
That's true.
Doctors learn from us. We also learn from them.
That's true.
But when you begin to think that you have to learn all from the doctor, that's when you miss it. Yes, because we have our scope in which we practice with, which if we leave it on grounds right now, no other cadet can take off. Yes, you've seen us being on strike and how the hospital have shut down. Whilst there are other cadets there, they have to call on us. So we are basically the central part of it. So we should challenge ourselves. Then we should keep reading, like we should keep updating ourselves. Yes, you see, these are the things that the doctors used to beat us. Like doctors who always be updating themselves. Then we nurses, we feel like what we know from school should sustain. Yes. So basically, like you are going on rounds, then they get to pressure you with questions. What they have updated themselves with, then they are coming to intimidate you with. Yes. So with that, then people are intimidated and they're quelling. No, we should come out. Then we should be able to act as advocates now for the patients, because we feel our advocacy is really helping. One way the days that we could just take in anything that the doctor orders or demands without logically thinking it through. Yes, but now we have gone past that era of just taking instruction from doctors.
That's true.
But practicing as a team. If a doctor gives an order that I feel wouldn't align with the condition on ground, or possibly might harm the patient, I can as well, not in the rude manner, but will get a dialogue and get an understanding on that wise, then do what is best for the patient.
Thank you so much. I think we are doing our hours, our minute is still running, but then there are still things we need to discuss and talk about, because since we have gotten the opportunity to meet the nurse, we have to make sure we exhaust the nurse, because there are a lot of questions in the society about nurses. You know, there are certain things we need to know. Yes. Okay, so let me bring this scenario. I am your friend, right?
Yes.
And I've seen a girl.
Okay.
The girl is your client,
okay.
But the girl is a RVI infected patient client, right? Okay. And RVI simply means ACE, right? Or it's not? What's it?
Retroviral infection.
So retroviral infection. Yes. So ACE client.
Yes.
So meaning I'm trying.
You are doing very well, Dr. Apple.
I beg. So the girl, I've seen a very nice girl. The girl is your client. Then I came to you.
Yes.
Then I showed the picture of the girl to you. That Charlie, I've gotten this girl. Charlie, the way I feel, I'm your friend, right? Yeah. Does your ethics give you permission to tell me the medical condition of the girl?
This is a very big conflict of interest here. Because I'm trying to save a friend here, and I'm trying to maintain the confidentiality of my client as well. But nonetheless, I'm a nurse, whether at home or at work.
Okay.
Yes, and my client remains my client.
Okay.
My friend remains my friend.
Okay.
Yes, no disparity.
Okay.
But basically, I wouldn't disclose. Well, the only thing I can do is to deter you from her, or talk you out of it in another way that you might not even get a clue on that wise.
Right.
Yes.
Right,
yes.
Right.
But then disclosing to you will cost me my job.
But this is a girl, you know, Charlie, you get everything, like boobs day, nyams day, height, everything day, skin day, everything, face, everything day.
Everything, jeje.
She's 10 over 10. And, you know, Charlie, in that case...
This is a big one. This is a big one. You know, aside that, we have something we call beneficence.
Okay.
That's as in... we do all non-maleficence to do no harm.
Okay.
So in as much as I want to maintain the confidentiality of the lady for my clients, I might not want to do you the harm.
That's true.
But not doing you the harm wouldn't be by disclosing the status.
So would that particular thing be one of the mistakes a lot of nurses are committing today?
Oh yes, like basically, you know, even confidentiality and privacy when it comes to that. Even within the healthcare team. Say you are not in my ward. Or you are not in my unit. And there is a case going on in my unit. And I come to disclose to you, it's break of confidentiality.
Oh, I see.
Yes.
I think one of our sessions we sit down and talk about the ethics of a nurse.
I'm really ready for that. Because that means we have been taking those things for granted a lot. Yes, because we feel because he's also a nurse, so I can disclose. No. So far as the person doesn't need the services of that particular healthcare giver, the person doesn't have the right to know anything about that. You are the one in charge, so you should just keep everything to yourself until I am being referred to you, or we need your services as well. That's the only way I should disclose. But I think this one there is going on a lot. Sometimes I'll call it that. Charlie, this case now I've seen, no, Charlie. The girl, Sana, my ID inside, but Charlie, now I get this thing. It's some of this breaching of confidentiality.
Okay, so we've been hearing this. It's a rumor.
Yes.
I don't have any evidence.
When it comes to nurses, they have a lot of rumors.
So there are rumors. You the nice ones that are nurses, that are nice boys. When the nice girls comes to the hospital and maybe they are on their bed getting better, sometimes you help them get better, you know, intimate wise or sexually. Is that true?
Wow.
No, and the girls too, when they meet, Osu and Co, the boys, fine boys, sometimes they service them inward and outward. What do you have to say about that? It's a rumor we've been hearing. Yeah.
Well, that's why it remains a rumor. Okay. Well, I would say the number of nurses who have gotten married to their clients, maybe 2 out of 10.
Sure.
Yes. Why am I saying this? We are not allowed to date our clients even outside work. But doesn't mean if your wife is your client, you remain single. Yes. It will happen in rare situations, but then we wouldn't say it's something that is of the bare or obvious to the fraternity that the fine boys or the fine girls, when they meet their clients, they do. No, they like, you see, out of care, people take it to be like love.
It's true.
So we encounter this lot of situations. Personally, we encounter a lot of these personal situations whereby taking care of the fine ladies ends up making them feel like we have some sort of feeling towards them, which is not true. It's just our work.
We thank you for clearing that out from the system because your colleagues they'll be watching and they would want to have the say, but they can also add their perspective in the comment section. So thank you so much for this particular session. And I think that we will have episode 2. We are not done. We have episode 2. But I think my question is, with the kind of training you have from school and the kind of experience that happens on a job, do you really think that you are being resourced well to face the challenges at the job site from the school?
As in resource, as in knowledge-wise?
Knowledge-wise, practical-wise, emotional-wise, ethical-wise. I think the schools are resourcing you well for that purpose.
Very well. Ghana, we believe in books, Charlie.
Okay.
We believe in books. And acquiring knowledge is very, very much noted in Ghana. So, seeing equipping is going on really well. They really train us, because I could remember my time back in school. I had this friend who was in the medical school. We have this course we call the anatomy and the physiology, which runs through most of the health. These things all about the human body and the human stature. So we were so in depth into some of the topics that he got asked me that why are we doing medicine in the nursing side, like my school? I was like, no, like it's just the same thing. Like it shouldn't change. Like if we see the ear, we should all identify as the ear. So if we feel like there should be a change about it, then it will not help. So in as much as maybe we don't go so much into details, but then the equipping is very, 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 very well, unless somebody doesn't want to really take it. But I think the equipping has really helped us, and most of us have benefited from the equipping. So I wouldn't say they have inadequately resourced us for the forefront, but then they have really equipped us for it. It's just sometimes
so when you
that details.
So when you came from training school to practice, like was there a time you realized that this thing lecturer told us in school is not the same as the job? Like has it been a time?
Yes.
So those students watching us now, what should they expect on the field? Like
it's like it's not everything that you'll be told. It's not everything that you'll be told. I can remember that we bed bath our patients. We bath our patients simply in bed. So I can remember that during one of our practical sessions or demonstrations, so we have a procedure manual, right? That outlists all the steps that you have to carry. So the procedure didn't identify where I should drop my sponge after cleaning the patient with a sponge.
Okay.
Do you get me?
Okay.
So that's where your discretion comes in.
Okay.
So we got halfway into the bathing. Then now I was holding my sponge.
You didn't know what
now
to do.
Because I was going accordingly, systematically, meticulously according to the procedure manual.
Yeah.
So I want to meet every step. Now, where to drop my sponge wasn't part of the step.
Wow.
So I was wanting.
Okay.
So I just have to logically think it through. But the sponge, the leak is there. Okay. So I just had to drop it in. So, and it became a practice for everyone that when you are bathing a client, you just drop it on the lid of or you get an additional sponge that you can drop it in. So it wouldn't, the training wouldn't tell you everything basically. You get on the job, then you get to experience some of the things and change. There are certain things that maybe the books will tell you that this is how we go about it.
Yeah.
That you have to do A before B.
Yeah.
But when you get to the field, you have to do B before you can achieve A.
Okay.
Yes.
Yeah. Okay.
There are certain things.
Okay.
There are a lot of examples.
Yeah.
There are a lot of experiences to share.
Okay.
So it's not basically that from the book directly we extend it to the field. You extend the knowledge from the book.
Okay.
But the field is a different ballgame.
Okay.
That's when you have to bring yourself as what can I do to save.
That's true.
With the book backing you, the book is just like a backing.
Okay.
Then you are trying what you can do to save. That's
so has there been a time that a doctor prescribed medication for a client?
Yeah.
And you as a nurse, you verify the medication with the condition of the client, you realize that the doctor made a mistake.
Oh, it happens.
What do you do?
Well, that's what I'm saying. That's why I said earlier on that you have to just dialogue. When those such situations happen, don't be the hero in the situation. Okay. Some of these things we don't even relay to our clients. Okay. Whilst the law says we should tell them. Okay. When I'm about causing harm to you, I should be able to tell you, even when it fails. Whoa. That's what the law says. Yes. Whoa. Yes. But we keep it away because maybe to prevent legal issues and all sorts. And it's not everything that maybe we want the client to know, but they are supposed to know. That actually the doctor was prescribing drug for you, they prescribed the wrong drug. The doctor has to come up clean that I prescribed the wrong drug for you.
No, so with that one,
yes,
right?
Yes.
You made mention that some of the mistakes the nursing are doing now is that they don't learn more, they don't read more, they don't build capacity for the thing. So I asked that question because here lies the case. We've been hearing wrong prescription administering of drugs that are not supposed to be administered to some patients in their condition. Maybe somebody came with a headache, but the person is having underlying, like let me say, ulcer. Then as soon as you heard of headache, you begin to ibuprofen and co. You understand? Resulted in a different thing altogether. What I'm trying to say is that with this particular situation, right? When it happened, you as a nurse, because you have the data and you have closer to sometimes let me say a patient can come to your facility, but he doesn't have any history there. So you didn't get opportunity to know he has an ulcer or she has an ulcer. But at the time you were talking to the patient, you discovered that the person is having an ulcer. But your doctor has prescribed ibuprofen and those things too. You as a nurse, what are you supposed to do?
Oh, you're supposed to just get back to the doctor, get an understanding. I'm not sure any doctor having the knowledge of that or of the patient having an ulcer, which is a predisposing this thing already, would want to intentionally do that. So sometimes it's, even when it happens knowingly, I may say it's maybe out of overwhelming of the patients. You know, one doctor has to see 100 cases before the day ends. So maybe the pressure might lead to some of these things. But when we encounter, we deliberate within ourselves.
So
then we just correct and do the right.
And when the doctor insists you should use, what would you do as a nurse?
Well, that's where the advocacy comes in, because I think I don't know whether you are privy to one encounter between a doctor and a nurse.
Yeah,
that is where it happened that the doctor was insisting and the nurse prevented the situation. Now that's what I'm saying, that we've gone past those days of saying yes and master to the doctors, like in quote, that we are working as a team now, in as much as they are our bosses. We are working as a team. So the same way they will correct us, the same way we might also correct them. So I wouldn't say correction per se, but we are checks for each other. So especially, it happens a lot. A lot. That's why the nurse too is there. That's why the pharmacist too is there, and any other cater to help the situation.
Okay. So my last question is, as a nursing officer, is it advisable as a nursing officer to have clients that you prescribe drug? You literally like go to their houses to take care of, like I don't know what I understand my point. You being here, you have clients that they call you, this is happening to me, so wait for me in the house, I'm coming. Is it right? One, is it right? Is it ethical? Number two, is it safe?
Well, not safe, not entirely. It's a risk we all take. I wouldn't exempt myself. I do that a lot. Because basically my mommy wouldn't call me late in the night, going through something that I know I can save the situation, that I would miss it out. You as my friend, you wouldn't call me for something peculiar, then I would want to really leave you on that to suffer. And then is it ethical? Not actually.
It's not ethical.
Not actually.
So it's a
I'm
risk,
not condemning it entirely, because
so it's a risk people take. But you know your colleagues, this is what most of your colleagues have been doing.
Some people go to the extent, if they could have even performed surgical operations at home, they would have. But then all boils down to the fear we have acclaimed, or we have attributed the hospital with now. A lot of patients are scared of coming to hospital because they don't trust situations, but it's not ethical. It's just something we do to save. So
you admit that a lot of people are scared to come to the hospital because they don't trust.
Yes, the system.
The system.
Yes.
Is there an effort to keep that situation?
Yes. There are a lot of efforts going on, like to keep the situation, because we have to build a trust. Health itself is psychological. So the moment you make your mind that this person wouldn't touch me and I'll be fine, you will not.
I see.
Yeah. So some people come to the hospital. They don't even get treatment, then they are good. Just visiting the hospital. Some people feel it's a place for healing. So when I get there and I just perceive the hospital center, then that's it.
I think our time is running. Yes. Like I would have asked something, but a quick one. Sometimes somebody will say they got a patient. As soon as they brought him, I know the person will die. I just know. So sometimes, instead of even the nurses to attend to the person, sometimes like basically you see them, pulling their legs here and there. It doesn't happen often.
Well, it happens. It happens. Like there are some situations that basically we can't save, like this out of hand. But we are there to give hope, regardless. So we have even a specialty of nursing, which is the palliative. They, no matter what, they keep with you, like they take care of those chronic situations for long, that they give you the much hope that you need. So even if we know that the next minute we are going to lose it, we believe in miracles. We are still supposed to put in our efforts. But we are individuals. Some people might give up easily. What I might give up on, somebody might take it up. Yes. So basically, I would say it's an individuality. So some people can just see the situation and they want to attribute it as such. Like conclude basically as such. So we see the situation. The nursing said we should nurse till death.
All right. So thank you so much, Dr. Slim. I think I'm much grateful for, and myself and the audience of Echo Studios, we are very grateful for appearing on the Expert Desk, and I think most questions are going to happen on the comment section. So since you also have our channel, you will be following in the comment section and you'll be answering. So he's part of our DM and you'll be answering some of the questions. If you have any question to ask, just ask in the comment section and definitely subscribe and follow us and share to your colleagues to also know. So it has been an Expert Desk from forms to frontline. Today we tackle nursing, and next episode we are going to talk about different things. And I did this with Dr. Slim, a registered nurse.
Yeah.
And
currently specializing in orthopedics.
Orthopedics, I see.
The bones.
All right. So he's now specializing in orthopedic, and in our episode 2, you asked him why he chose that path and some of the career paths of nursing, aside of being at the ward and other things. My name remains EKO Echo, and I did this with Dr. Slim. Thank you.
Thank you very much.